Hello, my name is Galina, and I just wanted to put out a video about my experience with acquired hemophilia A, pregnancy acquired hemophilia A, and the things that I've gone through. The reason why I'm putting out the video on this topic is because when I was diagnosed with the condition about a year ago, when I tried YouTubing videos of this condition, I didn't come across anything on YouTube that was like a personal experience from somebody going through this pregnancy acquired hemophilia A. So I thought, you know what, let me just put out my experience out there, and hopefully maybe it will encourage somebody that's going through a similar process and could just kind of feel alone and overwhelmed and kind of lost with all that's going on. Sorry, I'm a little congested, but I'm fine. So I just wanted to do the video before I didn't do the video. So yeah, here we go. So I got diagnosed, like I mentioned, around a year ago, after giving birth to my kid, my second child. I'm in my late 20s, and so my pregnancy was very good, extremely easy in comparison to my first one, and my first one was actually uneventful too. But then my delivery was pretty good. It was pretty quick, so I didn't even get a chance to get an epidural or anything like that, so all natural. Delivery, recovery was very good too. The first 3 months after giving birth was really good. But then at around 3 months in, I started experiencing all sorts of bruising, and it was actually set off by, so once in a while I get this condition, it's called lateral pelvic tilt, where my pelvis tilts, and I'm a little crooked walking around for a little bit, and then it just goes in by itself. And this condition started probably in my late teens or early 20s, and it happens seemingly randomly maybe once a year or once every other year. And so I got the lateral pelvic tilt, and then I started getting bruising, and I was like, okay, well, you know, maybe it's all related, maybe not. And I went to the doctor, and the doctor's like, oh, you're probably just getting bruises just because you have a newborn, a 3-month-old, and so maybe you're just bumping into things, lack of sleep. And so I was like, okay. But then maybe after a week of having the lateral pelvic tilt, or even maybe a few days, it went away by itself. But then my knee started hurting very, very bad. My right knee was just hurting. It was just so bad. I couldn't sleep, I couldn't walk, I couldn't do anything, so I ended up going back to the doctor, seeing another doctor, and I also developed a bruise under my tongue. It was pretty scary. It was like under my tongue, and so I went to the doctor saw that and saw all the other bruises I had, and let me backtrack. Before I had the bruise under my tongue, I thought maybe I hit myself on the knee, so I ended up getting an x-ray, getting an MRI, and both of those things showed that there was just non-specific edema, aka just like swelling, but nothing structurally was wrong. So after the doctor saw that I had the bruise under my tongue and all over my legs, they're like, okay, well, here's a referral to a hematologist. A hematologist, like a blood doctor. And so I went to the hematologist. They took 30-something vials in 2 days, tested me for all sorts of things, and that's when I was diagnosed with acquired hemophilia A. That's basically when my blood is not clotting properly, so it's just kind of bleeding, and so my factor VIII, one of the proteins, was very low because I had an inhibitor that my body developed, so it's kind of like an autoimmune thing. And so the inhibitor was attacking, as far as I understand, the factor VIII, and my blood wasn't clotting properly, and so I would have these spontaneous bleedings into my muscles. So that's why I had that crazy knee pain. It was just because I had bleeding inside of my muscles, and it was just like, I guess like a huge cramp or something, but I couldn't sleep. I was just taking Tylenol, like the maximum dose that I could, just to try to sleep, but even then it was like very difficult. Had to have my limbs elevated, so I would lay on the couch, elevate my legs all the time, just to get the swelling to come down. I would ice it. Icing the area was probably the most helpful thing, just kind of massage and ice. Oh yeah, I also saw a physical therapist before I got diagnosed with hemophilia, and it was just getting worse and worse, and the physical therapist was like, I don't feel comfortable seeing you, just because your condition's not improving, so it's probably something else. But anyway, so I got diagnosed with hemophilia A, and then, so my knee actually eventually passed, like the pain passed, but then my other knee started hurting because I guess there was bleeding in my other knee then. So I knew it was nothing structural. It was definitely just random spontaneous bleeding. So it's just a very crazy time. I was on crutches. I was in a wheelchair. I couldn't move around. I couldn't walk. So a lot of people were helping. Our church had like a meal train type of thing going. Really, really kind. People were just really, really kind to us. But, and then a few months after all of this, I started getting like abdominal pain. And so the scary part about this condition is that you can also have internal bleeding. So I started having some internal bleeding, abdominal pain, but I was like, I'm just gonna kind of sleep it off, whatever. And then it stopped. But then a couple days later, I passed like a huge amount of blood through my bladder when I was like peeing, a lot of blood, and then I was bleeding for maybe like 2 weeks, and then the bleeding stopped. And after all that bleeding, miraculously, seriously, nothing short of a miracle, my condition subsided. So my condition started early September. I got diagnosed probably late September. And then December, my condition, I had absolutely no symptoms around December, and I'm very, very thankful because I was gonna get on prednisone. I always say it wrong. I hope I'm saying it right, but basically it's just kind of like a steroid type of treatment where they wanted me to do, I think, 60 milligrams or something, so a huge amount, just to try to kill off my immune system, to restart my immune system, just in hopes that my autoimmune Pregnancy Acquired Hemophilia A would go away on its own. But even then, I think even taking that medication to kill off your immune system, I think they only told me it was like a 50-50 chance that it would work. And I was gonna take it, but then I wanted to breastfeed my kid until 6 months old. So I was just kind of pushing it off because my condition would get better, and I was just like, okay, I could push it off, and then it would just get like worse, and then it would get better. And so very thankful that I was able to breastfeed her for 6 months. And then I was literally about to take my medication, the prednisone. I already had it, I already picked it up from the pharmacy, but then ended up not taking it because my condition improved significantly, and there was no need to take it. I felt great, and to this day I feel great. It just spontaneously came upon me and spontaneously went away. And so the hematologist was saying that my situation was a little bit unique because even though the factory inhibitor went away completely, I'd have to do blood work like so often. So my inhibitor went away completely. That's why I started feeling a lot better. And again, spontaneously went away. Felt a lot better. Even though that happened, my clotting still wasn't normal. So that was just kind of interesting to the hematologist. And she was saying maybe I have some like hereditary thing on top of that. Maybe not, but like, to be honest, I was giving blood so often that I feel great, and I'm planning to do more blood tests just to see if I have some hereditary condition on top of that actually makes my blood clotting a little bit weird. But yeah, but that's kind of in the future. I'm taking a break from all that blood giving, because plus I was like pretty anemic on top of it all, and so giving blood, that just kind of made my anemia be a little bit worse. But so yeah, I was gonna do this video a lot more detailed, and with my numbers, my blood numbers. It's gonna show you guys charts with my inhibitor levels, raising and then dropping off significantly to 0, and my clotting. I was going to do all that, but then I thought that was going to be a little too technical. However, putting this video out, and if I get comments saying, hey, explain this condition a little bit more, maybe give us more detail on a specific thing, I'll gladly do that, because I know how helpful it may be, just because going through it by yourself is just so difficult. And I read somewhere that pregnancy acquired hemophilia, you have like 1 in a million chance of getting it. So probably not a lot of people that are going to be interested in this video, but even if there's one person, I'll gladly do a follow-up. And oh yeah, and also what helped me, like socially, mentally, also was on Instagram, I searched up the hashtag Pregnancy Acquired Hemophilia A, and there was a girl that used that hashtag that documented her progress or her journey through this condition. So that was really cool. I sent her a message, and we would talk, and it was really encouraging. For her, she never had internal bleeding like I did, but she had compartment syndrome, which is when you're bleeding so much that there's so much pressure that the pressure just kind of presses down on all your blood vessels, and that prevents blood from going to your like extremities, like your fingers, your toes, other places, and so you get like huge hematomas or like bleeding. And if it gets worse enough, you could be admitted to the hospital. They have to make incisions in you, like straight up incisions, to let the swelling swell out beyond your skin. So just they make incisions, swelling, just so your blood vessels won't be constricted, so the blood can travel to your extremities. And so she had that, but yeah, I was kind of scared of that because I started developing all sorts of, things, and it was just a crazy experience. And like I said, people from our church were very kind, brought a lot of meals when I couldn't function. My husband was just amazing. Family was amazing. A lot of prayers. I mean, me getting over this whole illness as spontaneously as it came, I really see it as miraculous, because besides rest and icing, I didn't really do much. So yeah, like I said, mention in the comments if there's something specific you want me to discuss about this condition and my journey. I'll gladly do it, but if not, that's okay too. All right, have a good day, and